We see that so often our students come into programs, they're really gifted at memorizing. That's how they've gotten into the program. But getting them to draw inferences, make conclusions, make deductions, to take in all the information, to give weight and value to different pieces of information, and then be able to make decisions from that. I think that's one of the biggest challenges that we have in progressing them along in clinical reasoning processes.
On today's episode, we're joined by a veteran educator and clinician who's been shaping the next generation of physical therapists for nearly 3 decades. Dr. Chuck Hazle has taught clinical reasoning, manual therapy, and medical screening to students at the University of Kentucky for 28 years. Known for his rigorous practical exams that strike fear, and eventually gratitude, into the hearts of his students, Chuck is passionate about preparing PTs for real-world practice. Today, we'll get into how Chuck teaches clinical reasoning and manual therapy in ways that truly stick with his students, the evolving role of imaging in physical therapy, and the impact that conferences like AOMT can have on students' professional development. With his wealth of experience in both the classroom and clinic, Chuck offers invaluable insights into the future of physical therapy education. Don't move. This is Hands On, Hands Off. Chuck, welcome to the podcast.
Thank you. Honored to be here.
It's like radio, but it's recorded here live at AOMT 2024.
Right.
I said before we hit record, but want to say it again. Congratulations on an award. I get to brag. I get to bring the award up.
Right.
You don't have to.
Right.
Some people giving some saying some very nice words about you. Some really nice words about you. How'd that make you feel to hear those things?
Well, it was honestly a little bit overwhelming. I became aware of the nomination back last spring. Some of my past students and people that I'd worked with for a while decided to submit this kind of nomination, and I really didn't think about it much. And then in the summer, I received email notification of being given the award, and I was honestly overwhelmed at that point in time. As I explained to Matt Fitch, who I think was the principal individual behind the nomination, I said, Matt, I'm just a worker bee who tries to get students to think and use their hands a little bit. I'm not anything close to in the same league as a lot of these other folks in this organization. But that's basically been my job for 28 years, is to get students to think and use their hands.
Is it also to sort of frighten them on practical examinations? That's the word on the street that I'm hearing, is sometimes your practicals strike fear.
That does tend to be a reputation I have. In fact, students will tell me, I've done this long enough now, that students will tell me 20 years later that they still remember those practical exams. But now they can laugh about it. At the time, they were quite anxious, but then now they can laugh about it.
Well, the word also was it made them study really hard. It made them, when they knew the challenge was there, they rose to it.
That's the idea.
Right. Yeah. That's great. So you've been teaching clinical reasoning and manual therapy for nearly 3 decades.
Right. I was very fortunate to get an opportunity to assist in a class, and then that gradually mushroomed from assisting in 1 class to 2 classes to 3 classes to 4 classes.
Wow.
And then the opportunity for a full-time position came along, and so again, I've been very fortunate to interact with a lot of people who have been very supportive and who have provided for great opportunity in my career.
Well, you've been doing this one thing, right, teaching, for so long. How have your methods in education evolved? Like, I feel like you've been doing it long enough. You can look back and say, hey, here's how things changed.
Well, we were actually just having a discussion about this, is that education really has evolved quite a bit, and how we interact with the current generation of students is quite a bit different than what it was 20 years ago.
Help me understand.
Oh, wow. We could have a conference just on that.
Really?
We could have a conference just on that. The methods of how you connect with students and how you interact with them is a little bit different, and you have to really tailor your approach to individual students more so than perhaps what you had to do in the past.
And is that as the generations change, or is that as what we learn about the best way to educate? Is that nature or nurture?
I think it's a little bit of both, as you might expect, but it seems to have that type of change in how we interact with students seems to have accelerated, particularly since COVID.
Yeah.
Last 4 or 5 years, you've seen educators have to adapt.
To. Yeah,
right.
So you always have to, because if you didn't, nothing would have gotten done at that point.
Exactly.
Yeah. In addition to manual therapy, you also teach imaging and medical screening. How do those tools complement manual therapy? I mean, I think on the outset you could say that they oppose, but how do they complement manual therapy in the clinical setting?
Well, I think a big part of it is that we're trying to teach our students to be very competent, skilled primary care providers. So the medical screening angle, along with understanding imaging and how imaging interacts with medical screening, as well as the daily decision-making that we undertake, that's an important piece. In fact, we have a presentation, Bob Boyles and I have a presentation tomorrow on how imaging and manual assessment of the spine interact and how they correlate with each other.
Yeah, so good to look at those things not in opposition, but in tandem. We mentioned before you're known for your rigorous practical exams, which students both fear, and appreciate.
Right.
So what was your philosophy behind creating such high expectations during practicals? Did you really wanted to make the best clinicians possible, or?
Yes, I just wanted to prepare them for the real world. I mean, I saw that as my job. It's of no value to provide for exam procedures that are not a learning experience in their own, so that the practicals are not just an assessment item. The practicals are still yet another method of teaching, and I think that's part of why they remember it for so long. But they sometimes see me as being very demanding, but again, it's part of it too is I don't want them to make the same mistakes I did as an entry-level clinician. Yeah. So I want them to come in and be prepared for the real world and some of the challenges that they're going to have as they enter into clinical practice.
Yeah. As an educator, someone's been doing it for as long as you have, what do you think the biggest challenges that you see in preparing students for real-world practice, as you just mentioned? What are the biggest challenges today?
Wow, that's a tough question to answer. I think our students come into DPT education now. They're a little more mature. They tend to have more challenges themselves personally.
Sure.
Being a little older than what we had back in the days when we were just bachelors and masters. Now that we typically deal with older students and they have their own life challenges, and getting them to balance everything. PT education really has the difficulty of we're finding more and more things that we need to perpetually add, and we're not taking anything out.
Right. Yeah.
So the challenge is how do we balance all this? How do we provide for all the education that our students need in order to be able to function in clinical practice, but not just completely overwhelm them along the way? I think that's actually one of the biggest challenges that we have as educators right now.
I remember when I would, as a second-year student, you'd talk to the first years. As a third year, they bring you the first years again. And the one thing I would reiterate was it's a lot like imagine what working in a post office is like as a student, which is do your work today because there's going to be another pile just as big, if not bigger, tomorrow. And if you take a day off, you're going to be snowed in.
I haven't thought of it like that, but I'll have to remember that. I'll use that in the future.
Time to make the donuts over and over again. All right, so last question I'll ask before we hit what we call your parting shot. Having spent nearly 30 years in both teaching and clinical practice, what advice would you give to fellow educators and clinicians who are looking to better integrate their clinical reasoning and manual therapy into teaching or patient care?
That really becomes that's a really difficult question to answer. Our students have to learn. We see that so often our students come into programs. They're really gifted at memorizing.
Yep.
They're really gifted
Otherwise
at
they wouldn't have
memorizing.
gotten there, right? Yeah.
That's how they've gotten into the program. But getting them to draw inferences, make conclusions, make deductions, to take in all the information, to give weight and value to different pieces of information, and then be able to make decisions from that. I think that's one of the biggest challenges that we have in progressing them along in clinical reasoning processes.
Yeah, simple but not easy. Last thing we do is we call the parting shot. What's an idea, a sentiment, something you'd want the audience to remember as we wrap up today?
This, first and foremost, this is a fabulous organization, and that's one of the reasons that I value this award so much. I remember the very first time I came to this conference, it was from the encouragement of Matt Lee, who strongly encouraged that I should come to this conference. And the very first conference I came to, I thought, wow, there are lots of other people who actually think like I do. I have not seen this before. And then over the years, this is my favorite conference to come through. These are the highest esteemed professionals at this organization of which I know. And again, to have gotten that award from this group is particularly weighty.
That's great. Chuck, appreciate your time and coming on the Hands On, Hands Off podcast. Thank you.
Thank you.